on BBC Sounds,
on digital radio,
and on your smart speaker. This
is Asian Network's
Big Debate
with Qasa Alom.
So now time for our Guru Hour here on The Big Debate. Every Monday at midday, you have the chance to ask one of our experts any questions you have about their specialist area. This week, Dr Dr Venkat returns to talk about IVF. So if you have any issues, any questions about IVF, about fertility, get them into me right now. Are you thinking about starting IVF treatment? Do you want to know more? Or are you already going through the cycles? You want to make sure you're doing all the right things? Get in touch. Guarantee you a chance to speak to Geeta. And of course, as always, you can remain anonymous if you would like. Let me give you those details again. 03459 440 445 is the number to ring. If you don't feel comfortable ringing, you can also text 81869. You can WhatsApp me 07920 500 200. And the email is thebigdebate@bbc.co.uk. Geeta, welcome. How are you?
I'm very well, Kasha. Nice to speak to you and the people around, which is a nice thing for me.
Yeah, nice to speak to you as well. It's been a while since we last caught up, so I'm imagining a lot of people will have questions for you. We're just got to wait for them to come in. Sooner the better, please, everybody, because as I've mentioned, we are going to be cutting this short at about 12:30 this week. So yeah, get them in earlier, because I know usually we get a late flurry. Those questions won't get answered today. So if you know anybody who is struggling, get them into me right now. Anyway, we've already had a message in, and I want to spend a couple of minutes getting your opinion on this message, because it's not really a question, but I'm sure it's something that a lot of people are feeling. So Suki would like us to read this message out. It's not her real name, but we've changed the name because that's what she wanted, and we've respected that decision. But Suki says, when we got married, we tried for a baby for 2 months, and then my in-laws arranged for me to go abroad to try IVF. We're in our 20s, so I didn't think we needed this. I was against it. They pressured me into it. I did the tests, etc. And at the last possible chance, I managed to conceive. Women need to speak up about being forced to do things that make them uncomfortable and do things in their own time. So I know you are someone who, talks a lot about fertility. You are there to give people that IVF treatment as well. But is this something that you found common? People trying for only a couple of months and then straight away going to science to sort out their problems?
Yeah, there are, people with different ideas in their lives. But I think many young girls nowadays want to have a checkup, which I think is a good idea, Kasa, because even if they are starting to try or just to try it for a few months, it's a good idea to know where they stand. Is everything okay with them? With that knowledge, they can try with confidence. Whereas if there is any problem, it's better to know at the initial stages so that they don't have to waste time. They can do something about it. However, without knowing the fertility status, it's not a good idea to jump into IVF. Probably they won't need IVF. So first of all, to have a test, but I don't think anybody should force people to do things. And I know there is always some family pressure. People should say, look, let me go and have a checkup. And the checkup means it's not only for the female, it's also for the male. We should not forget the man. Both of them are important, and they should have a checkup to satisfy those people who are putting you under pressure. But don't jump into any treatment. That's what I would say.
How important is it to have that peace of mind, whether it's with the chest or not, just to know that if everything is okay, or if you are having challenges?
Yes, because nowadays I think people are interested in knowing, especially if they have started late and over 30 or 35 and they don't have much time, then it is better to have a checkup. Whereas Suki here told us that she is in her 20s, probably it is not necessary. She can try for a few months. If things don't go well or nothing happens, then she can have a checkup. it depends basically on the age of the woman. If someone is 40 years, it's better to have a checkup first so that they don't waste time. It varies from person to person. That's what I would say, Kasa.
It does. Clearly, that is always the way, isn't it? Individual cases or not. This is actually quite a good debate for our phone-in, really. But I'm going to ask you now, given the fact that we're talking about it, do you think couples sometimes give up too quickly and then turn to science, or do you not?
Well, now, of course, the treatments are available, facilities are available, but I don't think they run to the science saying, look, they want some help, but they want to make use of the tests that are available, which is a wise thing, because now if there is an issue, it's better to know. That is the reason they want to know. But I don't think they are jumping into treatment, because people are wise. They know that unnecessarily they don't want interference. Most of them want to have baby naturally, and they might seek some help with the natural conception to boost their fertility and help with some scanning to check when they are ovulating, but not go for serious treatments like IVF. I think that's what people are doing, which is the right thing to do, Kasa.
So tell us a little bit about this. The checkups that you're talking about. Are these checkup processes long, invasive, perhaps, or even expensive?
No, these checkups are very simple, basic tests to know where the woman stands and where the man stands. Basically, for the man, it is a semen analysis. So he produces a sample. We analyze the sample and see what is his sperm count and motility, all the parameters we check. So it gives a good idea whether the sperm is good enough to make a baby or not. And for the female, it is a scan, ultrasound scan to check the uterus and ovaries. And then we do a blood test to check various hormones. The best time to do this is between the second and fifth day of the period, or in the initial stages of the period. The patient need not continue to bleed during the scan or anything, because some people bleed only for 2 days, some bleed for 5 days. It does not matter. We just do it in the first 5 days of the cycle. That is the best time to do the ultrasound scan and the blood test. The only thing about the ultrasound scan is it's going to be an internal scan, or the vaginal scan, that I know women do not like it so much, because this is more accurate than the abdominal scan. We prefer to do it, and it takes only 5 minutes to do the scan and another 5 minutes to do the blood test, and they will know where they are. So these are basic tests. They are not very invasive. The only invasive test comes after this stage. This stage, once we know how many eggs one person has got, the uterus and ovaries are structurally normal, and the man is okay with all the sperm count parameters, then the next step will be to check the fallopian tubes. That is a little bit invasive, because we have to put a dye through the cervix and then perform an ultrasound scan to see if the dye is going through the fallopian tube or not. This is little uncomfortable, and people have some period-like pain. So this is little more invasive, and we don't routinely do it for everybody. Only if the first stage is okay and they are trying for a baby now, then we do it. And it also has an advantage. Sometimes flushing of the tube increases the chances of someone getting pregnant, because I have had patient who says she had a baby after flushing the tube, and then she came back for the second baby, said, "Doctor, this is time for me to have the flushing of the tube. Can you do it?" And I did it, and she got pregnant again. She had her second baby. And so this can happen. That's why we say it's a good idea to do it. But this is little more involved, and we have to be careful about it.
Thank you very much, Dr. Geeta Venkat there. If you have any questions for Geeta, text in 81869 or give us a ring, 03459 440 445. Salia has WhatsApped in saying, I've got a problem with ovulating. I have been told that I have good quality eggs, but they just don't release. Is there anything I could do here? I am currently lowering my BMI for IVF. I've got a BMI of 30.7. I was considering getting a gono injection and doing that, but is there a risk involved with this?
Right. This is a good question because this issue of not ovulating is common with the polycystic ovaries, and polycystic ovaries is a very common condition in among Asians. The incidence of polycystic ovaries is about 20% in Caucasian population, whereas in Asian population, the incidence of polycystic ovaries is 44%. So practically double the incidence. That's why it's more common. And many women with polycystic ovaries have lots of eggs, but they don't mature and ovulate. That is the problem. Yes, they usually try some simple tablets like clomiphene or letrozole to start the growth of the eggs and then follow it by a trigger injection to complete the process of ovulation. If that's not successful, then yes, gonal F injection can be tried. Only thing is, if you are having these injections, it is better to have ultrasound scans to monitor the process to see how many eggs are growing and how fast they are growing, because these are stimulations and they can lead to hyperstimulation syndrome, that is overstimulation. That's why it has to be monitored very carefully.
Thank you very much. Hope that's helped you out there, Salia. Really good question for Dr. Geeta Venkat. So Shivani has got in touch with the program, wants to speak to you now directly. Thank you very much. And this is the best way because you can get to ask follow-up questions. Anyway, Shivani, afternoon, you okay?
I'm good, thank you. And yourself?
Not too bad. Right, I'm going to pass you over to Dr. Geeta Venkat. So what's your question?
Hi there, Geeta. So
Hi,
my question is, so my husband and I are in our 30s. We've been trying for, I'd probably say, over a year now. We are a little confused what to do. Obviously, we haven't really been tested yet because of the circumstances at the moment. But my husband has a history of leukemia when he was 3 years old, which he's been in remission since the age of 7. We've had a bit of backwards and forwards of information about whether he would potentially be fertile or not. Obviously, I realise science moves on and learns since he was 7, but we don't know whether we have a chance of actually conceiving naturally or whether IVF is the best way forward for someone who has had radiotherapy and chemotherapy as a child.
Well, he is in remission. It's so many years ago, and he would have recovered from the effect of this radiotherapy and chemotherapy, usually, because I've seen men having had such treatments and recovered from that, and they produce sperm. And if they have normal sperm, they can, the couple can conceive naturally. So Shivani, it depends on the sperm count and motility. So the best thing would be for both of you to have a checkup, particularly for him to know what is the sperm count, motility, how it is performing. So if you do a basic semen analysis for him, it will give you the answer. And at the same time, it will be a good idea for you to have a checkup also, so that your side of things are okay. And if everything is okay, then both of you have a good chance in the sense like any other couple.
Okay. And then, so we'll just try and get tested. I think that's our main thing when everything gets a bit normal in the world.
No, it's a good idea. And like I said, it's an easy thing to do. It can be done in one visit, especially now people are worried about the COVID-19 and the risk of infection. And in fact, many women and the couples are worried whether the clinics are open or not. I would like to emphasize that all the fertility clinics have been advised that they can continue offering treatment to the women and the couples. They don't need to close like the first time. When we had the first lockdown, we had to shut the clinic. But right now, our regulator has given instructions that we can continue to offer treatment to couple and checkups and everything. And we have a discounted package now for fertility checkup. You can make use of it, and you can come between the 2nd and 5th day of your period for an ultrasound scan, blood test, and your husband can also come for the semen analysis. Everything is done in one go. And then we can have a chat about the result in 3 or 4 days time, because the blood test takes a couple of days. So we can discuss the results and say, give you green signal to go and try naturally if everything is okay.
Hope that's the news that you needed, Shivani. Thank you very much. Geeta, what's the odds now that they will, even without any tests, be in a better position to conceive simply just because that stress has been relieved a little bit?
Yes, that is true. That is true, because major factor is the stress in these things. It acts against all these things, and it affects the hormones also. And once it's relieved, that is the reason couples have this test, because they are worried that something might be wrong with them, and they get stressed. And if it doesn't happen in 1 month or 2 months, they think something is wrong with them. Once it's relieved, they try with confidence and relax. It will be much better. Even now, even before going for the test, Shivani may be pregnant.
Hopefully that will be the case for Shivani. Anyway, Geeta, next question from Asya. Not Asya's real name. We've changed it, which is something that if any others out there want to do, you can let us know. Drop a message to the producers and they will do that. And then we can get you on air to talk to Geeta without your name. Give me a ring 03459 440 445 or text 81869. Anyway, Asya says that her and her husband are starting IVF. They've been trying for a year and a half. Tests show that they can't conceive naturally, both mid-30s. Started medication this weekend, finding it quite a lonely journey though. Not something we want to talk about openly. Our parents have been really supportive. Do you know of any support groups you can suggest specifically for the ICSI process?
Yes, there are so many support groups. The main one is the Infertility UK, which is the fertility association, which supports all the people with infertility if they are going for IVF treatment. And the clinics or the hospitals where you are having the treatment, they have counselors. You can talk to counselors, because they arrange free counseling, and we also arrange free counseling during the treatment, so that you are able to talk about your emotions, how it is affecting you. Once you just talk about it, because these people are not going to judge you about what you are saying, what you are thinking. So it's a non-judgmental conversation. And if you just talk about all these things, you feel much lighter. I know it's not going to change what happens to you. However, if you talk about it, you feel much better. They are organization, and in the clinics where you have treatment, they might have patient support groups, or they will put you in touch with other patients who are doing the treatment, so that you can compare notes and say you can be a companion. We call it buddies. We have buddy system also, where we sort of pair people who are going through treatment, and they will be helping each other, because they suffer, they have all these issues and emotions, and it will be a good comparison for them, and they also understand each other's emotions. They will support each other. So we have various systems to support you. You don't have to suffer alone. Please speak out, seek the help, and you will really find the journey very different and less stressful, I tell you.
And I wonder, because a lot of people are worried that people won't get their background, if they're Asian or if they're in a mixed or relationship or whatever it is, people will feel like the counselors, whoever they're talking to, won't understand what they're coming through. What would you add on to that?
Yes, that is true to a certain extent, because sometimes, the English culture is very different. They are open about everything, whereas our culture is different. There is a stigma about IVF treatment, and people want to hide it. They don't want anybody to know that, they are not able to conceive naturally and they are having treatment. Having said that, these days it's the IVF stigma is much less. People don't judge you for that. There is this stigma only for using donor eggs and donor sperm, these kind of things. But other normal IVF has become more common now, and it has been accepted by people and society much more. So I don't think we need to hide about it, and people will be able to talk about it. But there could be some cultural differences with the individual you are talking to.
Mm.
But there are a lot of Asians also going through treatments in any clinic nowadays. And if you say that you want to speak to somebody with a similar situation, and they will sort of arrange it for you.
That's
Like I
good.
said, the buddy system, we try to pair people with similar circumstances and age group and this kind of thing, so that is easy for them. So we can arrange it. It is true to a certain extent, but we can overcome it.
And I wonder how much of a strain have you seen? Clearly, no names, not, and I know you're not going to give any anyway. But how much of a strain have you seen couples go through during this process? Is it important for them to talk to other people just so that they, the husband and wife or partners, whoever it is, can themselves get through it?
I know, but like you said, there is hesitation, Kasa, on the part of the couples to talk about it. They will think usually, oh, what will they think if I tell them everything? And
Yeah,
sometimes, the male partner is not so supportive. They don't want to say it. They'll think that, oh, she will think my husband is bad or something. It is not like that. People are different. They will understand. But I think there is always a fear amongst the people, isn't it? Like when you are doing anything, you are scared of telling the whole thing to other people because you are talking about your personal information, private information. And that is why I think people are scared to talk about it. But if there are people in similar situation, when you tell them something, they will tell you something else. So it is not going to be very different. They can help each other. And counselors and others, as I still told you, they are professionals. They are not going to talk about your issue to somebody else, and they are not going to judge you. So I think you can seek professional help, and it will make your journey better. Or you can just speak to the nurses in
it's
the
a good
clinic.
point.
In our clinic, the nurses spend time with our patients and making their journey easier for the patient, because they literally hold their hands during the IVF journey. It's not easy for anyone. It's very stressful. It's important that you talk to the nurses or somebody, their counselor, or some patient coordinators. There are so many people in the clinic.
Absolutely. So there's plenty of people for those to talk to.
But
Right.
only thing is we have to open up. That is the
Yes.
main difficulty I think
And
we have. Yeah.
clearly it is something that a lot of people need to focus on as well. If you are going through this, you don't need to go through it alone. Right, we're going to start rattling through a lot of these questions. We've given a lot of time to the questions we've had so far, hoping to give the same for all these ones that we've got coming through. We've got at least half a dozen to get through. Renu says, I've had a few miscarriages early on, then failed to conceive, had many tests, everything's come back normal. Eventually, after 3 sessions of IUI, which failed, and waited a month during which I still continued to take medication to increase ovulation before our NHS appointment for IVF, I fell pregnant during the month's break. My mother-in-law used to take me to ladies who'd massage my stomach. I bruised terribly, only had 1 child, never conceived again, but feel very blessed. Thank you for your comment there. What do you think about this, Geeta? Is this a case of old wives' tales when sometimes you can do more harm even though family mean well, when they want to get involved and do things like massage?
Yeah, it is difficult to say. It depends on the person who's doing it, and it might have some effect, but it's also the psychological thing, people putting pressure on the daughter-in-law, this kind of things, that has more psychological effect than the physical effect. But massaging on the stomach, I don't know, because when somebody is pregnant, if they do rough massage on the stomach, yes, that can cause problem. But in between pregnancies, it's difficult to say. There are both sides to this, isn't it? Because it's difficult to answer. That
Very much
it's
so.
not clear, black and white. Yeah.
Let's go to Navida, who's got in touch with the program as well. Afternoon, Navida. What's your question for Dr. Venkat?
Hi, my name is Navida, and I'm age 35. So, trying to conceive for 2 years naturally. Went to my GP. They had my scan. Then they asked me to go for a laparoscopy. I think that's how they say it. Sorry. Then I have a dye test and everything, and then I have an AMH test. They said that my AMH is very low, and that means my ovarian reserve is very low. And I also have endometriosis. So they couldn't fix the endometriosis during my operation. And the consultant said I need an IVF because I cannot conceive naturally. It's very hard for me. And I cannot have IVF with NHS, and privately I cannot afford at the moment. So my question is, my AMH is around 1.2, and second time it was 1.7. My question is, is it okay for me to conceive naturally, or I must go for IVF due to my condition?
Well, yes, the answer is if you can get pregnant naturally, that is the best way, and that is the best treatment for endometriosis. The only difficulty is you have been trying for some time now and it hasn't happened. The message of the low AMH is, Niveda, is that your time is limited. Because, very soon, in a couple of years' time, you may not have eggs and you must have your baby before that. The reason for the consultant saying IVF is because IVF has got the high, best success rate and is the most effective treatment among all the treatments. Whereas if you try naturally, it might happen, but how long it will take for you to get pregnant, nobody knows. And if you are trying for another year, then if your egg number goes down further, it might be even difficult to do IVF at that stage. That is why I think it would be a good idea for you to go for IVF without any delay. I don't know why they are not doing in the NHS, probably because of the low AMH, they may not do it. I'm sorry to hear that you cannot afford to go private. But if you get pregnant naturally, that is the best thing that can happen. But your time is of the essence here. Please remember that. And there are some finance plans available in the different clinics, like you can. So seek some help, financial help, and go for IVF without delay, because endometriosis people have, because they have reduced number of eggs because of the endometriosis, and it gets worse, and the best treatment is IVF for women with endometriosis. I'm sorry to say this, but that is the way you can achieve your dreams. That's why I'm emphasizing on this, Niveda.
Okay, thank you. It clears everything for me now. Which way to go? Thank you.
I think the key thing there was you need to make a decision, be insistent with the NHS, and also, don't waste too much more. Well, not waste, but don't you got to act fast on this. Is what is the main thing that Geeta's been saying. Navida, thank you very much. Right. Got enough time for 2-3 more messages. Sam says, I'm listening to your show. I've been married for a long time, no children. I've tried treatments and medications. The hospital said my eggs are not developing properly. I love kids. I've tried everything else. IVF didn't work for me. What would you say here to Sam?
Well, okay, it's a bit of a complicated case. Now it's difficult to say the quality of the eggs, how good they are if the IVF has not worked with own eggs. The other option, which you may not like, is to consider using some other woman's eggs, younger woman's eggs, or, who has got good eggs and who has had children before, so that that she has got proven her fertility. So we call it donor eggs. That could be, if you don't mind that option, you can have children using donor eggs, and that way you can fulfill your dream.
Hopefully that will be something that you can look into there. Thank you very much, Sam. Jazz says, me and my husband have been trying for a while now, have been pregnant twice, can't seem to go past 6 weeks. My cycles varied between 26 and 38 days. Last time we were pregnant was June. I also have a rare metabolic disorder. We're in our 30s. Any advice?
So, okay, the first thing I would say is to find out your ovarian reserve, because whenever people have miscarriage, they usually have low ovarian reserve. So it's important to check the AMH and see what it is. And when there is low number of eggs, the quality can be sort of affected as well. That causes the problem of miscarriage, because when the quality is affected, the embryos made from these eggs have chromosomal abnormalities like Down syndrome, and that's why people have miscarriage. And that's why it's important to check your AMH. And if you want to avoid miscarriage again, consider doing IVF and checking your embryos. That is called pre-implantation genetic screening. And we can select the right embryo without any chromosomal abnormality for transfer. That way, we can reduce your risk of miscarriage and giving you a healthy baby. That's what I would consider in your case.
Okay, thank you very much. Last question as well. Hi, Qasa and Geeta. I'm 33. I've got a coil fitted. I want to get it removed next month. How fertile are women after it has been removed? Are there any vitamins or anything I can take to help with my fertility afterwards?
Yeah, that's a good question. People always worry about taking the coil out and see what happens. It depends on the woman's periods before. If somebody has regular periods and the normality comes back within a couple of months, then fertility is not affected at all by the coil. However, if somebody has had irregular cycles before, then the periods can be irregular after removing the coil, and that can cause problem because you don't know when you are ovulating and when to try naturally. That is the difficulty under these circumstances. And one more thing we should check is, because the coil has been inside for some time, there is a possibility of infection. So if you try for a few months, it doesn't happen,
Geeta?
then it's better to check the tube. But most of the women don't have any problem because of the coils. I think you should not have problems.
Geeta, always great to talk to you. We're going to have to leave it there. Stay safe. Chat to you soon. Dr. Geeta Venkat.